Sweaty palms, more properly known as palmar hyperhidrosis, is a condition that affects 1% of the U.S. population. We asked Dr. Eric Presser of Desert Regional Medical Center in Palm Springs about the causes. We'll find out how he has helped several patients afflicted with sweaty palms.
Hyperhidrosis. It is a condition that causes sweaty palms, sweaty armpits, and sweaty feet, and different variations, usually in those three body parts. Usually it's found in younger people. Growing up and being a teenager is hard enough. The last thing that you need is to have sweaty hands and sweaty armpits. Excessive sweat is what we're talking about.
Dr. Presser discussed a case of a patient he helped.
A 21-year-old male, and he was very embarrassed whenever he had to shake hands. Every time he shook hands, he had to wipe his hands on a handkerchief. He actually carried around a towel. So every time before he would shake hands, he would have to wipe his hands on a towel and say, "It's nice to meet you, sir or madam." And it is a social problem. It's extremely uncomfortable. He tried everything. He had actually sweaty hands and sweaty armpits, and the deodorants didn't work. I believe he actually did try Botox. It didn't work. But when you have sweaty palms, there aren't too many things that can work. Ultimately, if nothing works, then you can see someone like myself, who is a minimally invasive thoracic surgeon. And what I do is, while the patient is asleep, I do one side first. I go into the chest through two incisions that are about 5 millimeters to 1 centimeter each. I locate the sympathetic chain, which is parallel to the spine, and in a certain region you cut out a portion of it. And what this does is it decreases your body's response and creation of sweat. I've operated on him. I followed him for approximately a year and a half, and he was extremely happy, and he had no problem whatsoever shaking anyone's hand.
Dr. Presser talked about the possible side effects from the surgery.
You can have side effects where you can have sweaty palms and you do the operation, and then you can have excessive sweating in the axilla or in the armpit. And I make sure that whoever I operate on understands that with any type of procedure, there are always risks. But in this case, the benefits markedly outweigh the risks. One of the things I should mention is that the patient should obviously have any kind of metabolic problems eliminated prior to surgery, because there are certain types of diseases that can cause excessive sweating. The results are usually quite good. Most of these patients, as we mentioned before, are at the end of their rope, if you will. They will try anything. And given modern technology and what we are able to do nowadays, you can do this as an outpatient, where they have the operation in the morning and they can go home later on that day. Some people, when I see them at the 2-week follow-up, are doing remarkably well. Others, it does take a little bit more time. But for the most part, because they had such excessive sweating, most of them are very happy.